So this session is a part of the self-care week organized by Bromley Well. We are joined by local clinicians who will share tips and information on how to care for yourself and your family this winter. I'd love to introduce our panel members. They are Dr. Jon Doyle, GP Partner, Southview Partnership, Dr. Ruchira Puranjape, GP Partner, Knoll Medical Practice, Governing Body Lead for Southeast London Clinical Commissioning Group, Raj Matharu, Pharmacist in Bromley, Chair of the local Pharmaceutical Committee across Bromley, Bexley and Greenwich, Diana Norris, Lead Social Prescribing Link Worker with Bromley GP Alliance. So welcome you all. Thank you so much for attending this session. So my name is Namrita Bansal. I am from Healthwatch Bromley, and I'm going to give you a little overview of Healthwatch Bromley. So Healthwatch Bromley is a local health and social care champion. And whenever you use any GPs and hospitals, dentists, pharmacies, care homes, or other support services, we want to hear about your experiences. We want you to visit our website, share your experiences, or even call us to share your experiences on any of the GPs and hospitals, dentists, pharmacies, care homes, and other support services you use in the borough. And then we analyze the feedback and share the findings with the NHS leaders and other decision makers to help improve standards of care. So we have 6 main functions. We provide information and advice to people, especially people in Bromley, about accessing health and social care services and choice in relation to those services. We obtain the view of people, especially from the seldom heard communities, about their needs for an experience of local health and social care. And we want to ensure that those views are known to those involved in the commissioning and scrutiny of care services. We also make reports and make recommendations about how those services could be improved. We also promote and support the involvement of people in the monitoring, commissioning, and provision of local health and social care services. We make the views and experiences of people known to Healthwatch England, who then help to carry out its role as national champion. We also make recommendations to Healthwatch England to advise the Care Quality Commission to carry out social reviews or investigation into areas of concern. So what do? We have basically 6 main roles. We listen to, as I told you before, that we listen to patients' views. So we prepare reports on patient experiences of health and social care services. We also do enter and view, which is basically I don't want to use the word inspect, but we enter various care homes in the borough and also recommend how services can be improved. We do deep dive research studies. We also provide information to people who call us and also on our website and signpost support to various other services. We look for volunteers who can support us in carrying out our various activities. And we also work with local borough and local voluntary sectors in making sure that people's views are heard. So how can you share your views? You can go online to the feedback center on our website and share your views. You can email us at info@healthwatchbromley.co.uk, or you can call us. I'll share the number with you on our chat channel and you can access that. You can also fill our paper form and send it back to us via e-post. You can also request paper copies for your groups and communities. Now, you can also become part of a targeted engagement by filling out questionnaires for our research projects. And you can also attend the focus groups whenever we advertise it. So right now we are working on a project on cancer. So we will be advertising about it and you are more than welcome to share your experience. You can also volunteer with us to be part of this various projects we keep on doing. And we keep on advertising about it on our website and on our social media platform. This is our email ID, info@healthwatchbromley.co.uk, and our website is healthwatchbromley.co.uk. We are also there on Facebook and Twitter. Our our free post address is Your Voice in Health and Social Care, 45 St Mary's Road, London, and we are present in Community House in Bromley. Now I hand over to Dr. Jon Doyle.
Thank you, Namrata. Thanks, Healthwatch, for having us. My name's Jon Doyle. I'm a GP at Southview in Bromley, and Healthwatch have just asked me to speak for a few minutes about some top tips for staying well this winter. And then both Ruchira and myself will quite happy to stay on at the end to answer questions along with the rest of the panel. So a little bit about this winter. Although it's fairly mild at the moment, the cold weather is coming, and it's really important that we all do our utmost to take care of ourselves and our relatives. The darker days are coming, and I see a big link with low mood and anxiety as the darker days come in. Lots we can do in order to safeguard our physical, mental, and emotional well-being. Just take care of ourselves. So our advice would be to do the things that keep you happy, to make sure you're getting decent hot meals, at least one hot meal a day, do activities that make you happy, and keep in touch with family and friends. In terms of looking out for others, it's really important to look out for others more vulnerable than ourselves. And if you're worried about an elderly person, there are numbers that we can give at the end of the presentation for contacts at London Borough of Bromley Council and for Age UK. And obviously you can always approach your GP as well. Self-care is really the best way to treat lots of the viral illnesses that we see this time of year. And I think Raj and Ruchira would agree with me. We're seeing unprecedented levels of viral illnesses this year. But yeah, self-care, much the best for things like the common cold and viral symptoms such as earaches. You can get through these symptoms with sort of a bit of patience, rest, keeping warm, plenty of fluids, and over-the-counter medications. Raj is on next, but I would just make a plea that people do reach out to their community pharmacists when needed. They're a real brilliant source of lots of advice and expertise. In terms of flu, because of lockdown last year, the circulation of flu was extremely limited. So as a result of that, we're not sure, but we think that immunity may be a bit less this winter. And obviously this year is going to be the first year when we're back out and flu will be the flu virus circulating alongside the COVID-19 virus. In terms of those that are eligible for flu, I'm not going to run through every bullet point, but all residents over 50, those that are pregnant, children, and those with other health conditions. As you know, you can get your NHS flu vaccine, and we're always happy to accommodate at GP surgery, pharmacists that offer the service, midwifery appointments for those that are pregnant, and they offer it, and at some hospital outpatient appointments. A little bit about vaccines. So this isn't really a sort of COVID vaccine talk, but just to say that as the vaccine rollout comes down nationally, all of those healthcare professionals that are involved with the vaccine rollout do our utmost to fit in with the ask quickly. And we've got excellent coverage across Bromley with a mixture of mass vaccination sites, GP and primary care network sites, and some community pharmacies. And they're outlined on the map. We meet weekly to talk about changes to the vaccine program, any pressures that the system is having, and any problems that we've encountered. It's a really good group with representatives from each of those bodies that deliver the vaccine. and we'll continue to do that throughout the winter. So my take-home message really is to protect yourself and others through vaccination. So not only the COVID vaccine, flu vaccine, and the shingles and pneumonia vaccine if you're eligible. Tell you a little bit about shingles and pneumococcal vaccine. Shingles vaccine is available to those of us on the NHS between 70 and 79 who've not had the shingles vaccine before, and your GP should let you know if you're eligible. The pneumococcal vaccine protects against one of the commonest causes of pneumonia, and it's recommended that babies and those over 65 have the vaccine once, and some children and adults with certain long-term conditions are advised to have it every 5 years. Just in terms of how we're working within a GP practice, it's not just a GP that's there to help you. As you know, we have wide teams, so including the non-clinical team, the nurses, and now more and more you'll see other associated allied healthcare professionals, such as physios and pharmacists, and we've already mentioned the community pharmacists of great source of resource and advice. I'd now like to hand over to Raj, who I've had the pleasure of working closely with in the past. We're going to talk through some top tips from his perspective. Thank you.
Thanks, John. Really appreciate that talk. Hello, my name is Matharu. I'm a community pharmacist, and thank you for Healthwatch for inviting us here today to tell you a bit about community pharmacy and community pharmacy in Bromley. You're probably witnessing how the NHS is changing and how we're going to deliver services in the future. You'll see a lot more collaboration. You'll see a lot more partnership. I work with Jon fairly well, and you'll see that happening more and more as we move forward. We haven't really had a winter as such, I would say. It's nice and sunny outside today, but it is coming, and it's going to be challenging. I have a son who's a pharmacist and works in the Peru, and I have a daughter who's a GP trainee, and both of them come home utterly exhausted at the end of the day. They're both physically and mentally drained. The message is, the system is, NHS is under strain, and we really do need to make sure that we're accessing the right NHS service with the right NHS healthcare professional at the right time. And I guess it all starts with self-care. We need to look after ourselves. So we all know when we're feeling a bit under the weather, and sometimes it just needs a bit of rest and maybe an over-the-counter medicine such as paracetamol, and we recover fairly quickly within a few days. But you think if it's a bit more than that, then perhaps a visit to your local pharmacist is in order. I would say that your local pharmacies are probably becoming the first port of call for many Bromley residents to ask about their healthcare. At the moment, we're doing a pharmaceutical needs assessment in Bromley, which looks after the needs of Bromley residents, especially with respect to pharmacy services. And what we find is that the local pharmacy is about 20 minutes away from each resident, so quite accessible, open over the weekends, open late in many cases, and you don't need an appointment to see your community pharmacist. Community pharmacists are highly trained. We spend 4 years training, and then we have a year under clinical supervision before we actually are on the register and then face patients. And we're here to offer you advice on medicines, your minor ailments, your aches and pains, consequences, sore throats and the like. And during the pandemic, we did see an awful lot of people come walking into the pharmacy and asking many questions. And I think they've kind of got used to the fact that they can go into the local pharmacy and have a chat with the pharmacist. And you will find that pharmacists have a relationship with their patients. I locum on a Saturday, and I tend to have certain people that only come on Saturdays to have a conversation with me. And that's quite gratifying to know that they're actually wanting to be able to engage with you. Our training also provides us to spot any concern that we may have. So a few months ago, I had a lady that came into the pharmacy suffering from headaches, And chatting with her, we sort of discovered that her blood pressure hadn't been checked for a considerable amount of time. So I did a quick blood pressure check on her, and it was rather high. So I arranged for her to go along to her urgent care centre and be seen to where she went along and was treated, and we got her blood pressure back down again. So, as I said, we work quite closely with our local GPs. We, as you know, we do prescriptions and we look after the doses of the prescriptions. We also work with local hospitals. So there's a new NHS service called the Hospital Discharge Service, where we're looking at people's medicines, making sure that the right medicines that they come out with. And recently, we also started the COVID Champion Service. This was specifically around investigating the hesitancy around the COVID vaccination service, and it did highlight why people were not wanting to take the COVID vaccination, and which now South East London Clinical Commissioning Group are using to sort of inform patients on why they should get their vaccine. I'd also like to just highlight about the electronic repeat dispensing service that patients look at. If you're on a stable medication, regular stable medication, have a chat with your community pharmacy and see if we can switch you over to electronic repeat dispensing, which is batch prescriptions. So you're not going back and forth to your GP and the pharmacy. And what we'd like to do there is to reduce the sort of pressures on our colleagues in general practice, so they're able to look after patients more. And so this is the example, as I said earlier, that there's new ways of working, there's more collaboration between healthcare professionals to make sure that we're looking after our residents, our Bromley residents this winter. I'm going to hand over to Ruchira for the next bit.
Hi, afternoon, everyone. Thank you to Healthwatch for giving us the opportunity to have a presentation and tell you a bit more about what's happening in Bromley in health services over the winter. I'm going to talk about accessing general practice, something that's been in the media quite a lot recently. So we'll remember that it's been about almost 19-20 months since the very first lockdown back in March 2020, and general practice in the blink of an eye overnight really started to work very differently in a bid to keep services going for patients in the most safe manner possible, both for patients and for staff and for clinicians. What we found very quickly was that general practice learned to offer a digital model where it was appropriate and safe. But because that changed in the blink of an eye, it wasn't something that was planned over many months or in fact years with public consultation. I think some of our patients have found it very user-friendly, and some of our patients have found that quite hard. And we do know that back in summer of 2020, there were patients who were needed us and were not seeking help, or were unaware that services were open, or were unwilling to visit the surgery, thinking it might be unsafe for them. So it's important for me to stress that right through the pandemic, from the very first day, general practices have been open, and we have been offering services, and your doctors have not disappeared, and you should absolutely contact us if you feel that you need help from your practice. So just to go through how many practices, or the majority of practices I would say, are working now. So we are in a digital age. Many of our patients can and prefer to use digital services to access their GP in the same way that we do online banking or online shopping, so on and so forth. So it is a way, it's by no means the only way that you can access your general practice. So all practices are required to have online services so that you can use their website and a variety of tools to be able to explain roughly what's wrong with you, or the kind of issues that you have, and present some information that way. For those who prefer not to use online services, The phone has not gone anywhere. Receptionists have not gone anywhere. Practices are taking appointments by phone. Lots of people will have heard about the NHS app, and that gives you, if you're able to download that on your phone or your smart device, then that gives you access to various NHS services, including from your practice, your medical record. So when you first download it, there's some sort of initial information that you almost immediately have access to. And then if you want access to your full medical record through the NHS app, including how to view your own results and how to see your documents and things like that, then you usually need a password from your practice itself to be able to access your entire medical record through the NHS app. And then, of course, in person. So you can attend your practice in person and speak to the front desk. The way most practices are working these days is that we encourage patients to give a bit of information to us. So essentially, we're able to help steer patients to the right care by the right clinician in the most timely manner. So traditionally, this has always been done by receptionists, but increasingly with the use of online services and e-consultation tools, patients are able to unpack a little bit of what they need from the practice. This can be reviewed by a trained member of the team, and as I say, try and get patients to the right clinician within the right in the most timely manner possible. And I think from my own experience in my own practice, patients are very grateful to be able to get to services in a timely manner, and actually very grateful to be able to get simple things sorted out without necessarily having to wait for a GP appointment, which might be a number of days or a number of weeks away. And it's always very important to remember that actually it's the entire breadth of our primary care team, including our non-clinical team, experienced receptionists, experienced administrators, care coordinators, not least the wider clinical teams such as paramedics, physicians associates, pharmacists who are now also in practices. So the way GPs consult these days, again, there are a number of modalities. Practices are absolutely seeing patients face-to-face. We have absolutely been seeing patients face-to-face throughout the pandemic. Very often GPs will have a phone consultation first and bring patients down based on clinical need. And increasingly, obviously, if actually it's difficult to give your information ahead of time and actually you need a face-to-face appointment from the get-go, practices are increasingly accommodating that in the way that we used to. And a great deal of consultations can actually be managed online, particularly if they're relatively simple administrative inquiries. So GPs consult by phone, we consult online, we consult by video call, we consult face-to-face, and we are absolutely still conducting home visits where there is clinical need for that. So I just want to double check my notes, make sure I haven't forgotten anything important to tell you. I think I've covered everything, but please do ask questions from me in the panel later on. And I think I'm going to hand over now to Diana.
Hi, thank you. Social prescribers are one of the new additional non-clinical roles, and we're offering our services now from within GP practices. And we are there to support patients with issues that might be affecting your health and well-being that aren't directly related to a physical condition, a health condition that you might have been diagnosed with. So we know that our health and well-being is affected by much more than, as I say, conditions or illnesses we've been diagnosed with. Living through last year's lockdown, I think many more of us have experienced firsthand the impact that social isolation and loneliness, for example, can have on our well-being. So the Office for National Statistics runs a regular opinions and lifestyle survey, and it showed that almost 7.5 million people reported that loneliness had affected their health and well-being during the first month of lockdown last year. And in the early days of the pandemic, around 25 million people reported feeling symptoms of anxiety. And what was interesting about that was that some groups in the population that typically don't report symptoms of anxiety did during lockdown. So before lockdown, people aged 60 and above were very unlikely to report levels of anxiety, but that changed dramatically during lockdown. So, and all that is in line with what other research has shown about people experiencing social isolation and loneliness. So we know that people who are feeling lonely and socially isolated are more at risk of developing several physical and mental health conditions, including anxiety, depression, high blood pressure, heart disease, obesity. They may experience a weakened immune system and even experience cognitive decline. So being lonely has a real impact on how well we feel, but it's not just loneliness. We know that people's employment status has an impact on their health and well-being, and a direct impact on their physical and mental health, and even their life expectancy. And that's related to income, to whether they feel that they are making a valuable contribution to society. We get lots of social networks through work. And this can be why retirement, for some people, can be quite a tricky time. And we also know that housing conditions affect people's health. So research shows, for example, that there are strong links between overcrowding and experiencing stress and anxiety. So there are lots of things which might make people unwell. And given all of that, it's not surprising that it's estimated that around 1 in 5 GP appointments are made for issues that your GP isn't necessarily the best person to help you and advise you on. And that's where your social prescriber comes in. If I can have the next slide. So these are the kind of things that we can support with. So some of the things that I've mentioned that can affect your health and well-being. So we can support you if you have money worries, if you've been recently bereaved, if you're looking for work, if you're unhappy with where you're living, if you're struggling to manage a long-term health condition, and we've said if you're feeling lonely and isolated. It's not just problems that we can help you with, though. We can also help you if you want to make a positive change. So Jon was talking earlier about some of the ways that we can self-care for ourselves during winter. And he mentioned things like doing an activity that makes you feel happy, having a healthy diet, keeping physically active. And those are the sorts of things that your social prescriber can help you with. So what we'll do you may be given a social prescribing appointment by your doctor. Your doctor may make a referral for you, or somebody else, a pharmacist may do it for you, or the clinical nurse, even a receptionist, anybody within your GP practice that you come into contact with and that you might talk to about what's happening in your life might suggest that you have an appointment with a social prescriber. And then what we can give you is, what we can chiefly give you is time, because as opposed to having only 10 minutes per appointment, we can have up to an hour for the first appointment time, and then we can do several appointments after that. So we have the time to really listen and understand what you need, what's going on in your life, and to have a look at all the things that you're struggling with and where you might like to make a change, help you set some goals. And then the key part of what we do is link you to local services and sources of advice and support. And we're really fortunate in Bromley to have a very, very active third sector. So we've got lots of fabulous services we can support you with and link you to. And that ranges from well-known charities like Citizen Vice and Mind and Age UK, who in Bromley have all worked together to provide a service called Bromley Well, which some of you may have heard of, to right down to sort of your local church that might have a group that can support you and help you, a lunch club, if you're feeling lonely and want to interact with people. And the social prescriber's role is to know what services are out there. So we don't just sit in GP surgeries or at home talking to people, talking to patients. We also get out and about into the community, find out what's going on in the local library, in the local church, the local community centre, so that when we talk to you, we can put you in touch with those services. And you don't have to wait for someone to make a referral for you. You can also ask to be linked with a social prescriber if you think that that's something that might help you. And I can see some questions coming up for it. Okay, so I think that's it. And I'm handing on back to Nazarene. Okay, thank you.
Thank you so much, Diana.